We have a graphic that's showing some different ways we can diagnose PAD, and if you can just quickly walk us through those so we better understand the diagnosing process.
Yeah, once you are attuned to the fact that you may have peripheral vascular disease by the clinical findings, one of the simplest tests is basically getting what's called the ankle-brachial index, in which we're measuring the pressure in the arm and we're measuring your pressure in your ankle, and then we divide one by the other. In other words, simplistically, if you have 100 in your arm and you have 50 in your ankle, you've got 50% loss of pressure. Once you identify that you do have documented peripheral vascular disease, and your intent is to treat, as Dr. Del Conde earlier was alluding to, first it's a medical treatment, the vast majority of times, what we call cardiovascular risk factor modification, medications, control of sugar, control of lipids, blood pressure control. But once you are set into this, that the symptoms are progressively increasing, then you move into the modality that you need to do something either surgically or endovascularly, in which you'll need to do further road mapping to see where the problem is exactly and how to fix it.
And then we move on to those angiograms or ultrasounds, even a treadmill test.
Well, a treadmill test is a nice way to identify somebody that's got PAD, but at rest you can feel the pulses. However, when you make them walk, now the leg starts asking for more blood supply, and you get them under stress, put them at an angle, get them to walk faster. It's the equivalent of doing a stress test for your heart. When you induce the need for the heart or the muscle to contract more, be it your heart muscle or your leg muscle, and there's not enough oxygen, well, you bring out the symptoms of something at rest is asymptomatic. When you induce exercise, or you make the heart go faster by running on the treadmill, well, the symptoms will come out.
Right.
And you make something that's latent clinically important, and that's a very important way to find out if somebody really needs treatment or not.